Hi, I'm Dr. Greg Castello, board certified family practice with CastelloWellness.com, and I'm going to explain to you today why it may be better to be uninsured or underinsured as opposed to Cadillac Insurance, and why you're going to save thousands of dollars by doing that in this era of Obamacare. So everybody knows that healthcare costs are rising exponentially, sometimes 100%. This January 1st, there's going to be major hikes again. Deductibles are going to go up as well. People are paying more money for less insurance. So let's start with, if you're uninsured, your cost of insurance is zero. Let's say $1,000 is a penalty. If they're actually enforcing that, you're going to pay the government $1,000 because you don't have insurance. Go to the doctor, $125 a time you go to the doctor. You go to the doctor 4 times a year for sickness and physical once a year, $125 a piece. You spend $500 paying cash to the doctor. Medications, if your doctor knows what they're doing and they give you a little bit of assistance, most medications are very inexpensive, $4, $10 generic, good RX coupons, one's expensive, one's cheaper, cut pills in half. There's all kinds of things you can do to save money. So unless you have some expensive medication or chronic condition, you're probably looking at under $200 a year for medications, for a chronic even, and sick visit. So $200. Testing, if you need a CAT scan, MRI, chest x-ray, there's places that take cash. I can get you an MRI scan for $350 when it's about $1,400 at the hospital. A CT scan, $325 when it's $2,000 to have that same test done at the hospital. So anything we arrange for you test-wise, I make sure I send you to a place that has affordable rates. You pay them cash up front and you get the same MRI, the same doctor reading it for 1/5 of the cost. So let's say you need one MRI that year and a chest x-ray, so that's about $400 worth of testing I might do on you that year. Blood work, retail value for blood work for what I do for a physical is about $800 if you go to the lab and they charge you for the blood work. My cost is about $120. So even if you have the full-blown physical and something else, we'll say $120 for a year for blood tests. So grand total, $1,500, $1,700, $2,100, $2,300 we'll round up a year if you have no insurance at all, okay? Let's go to underinsured. So you have a $1,000 insurance plan for you and your spouse, or maybe one kid. It's probably much more than that, but your insurance is $1,000 a month, and that's $12,000 a year you're paying in health insurance. You go to the doctor and you have a copay. You might have a deductible to meet, so your doctor's visits might not even be covered, but let's say you get 4 visits a year covered for your copay at $25. You spend $100 to go to the doctor 4 times. It could be $500 if you have a deductible. Tests or scans, your doctor sends you to the hospital for your CAT scan. You get charged $2,000. You've got a $2,500 deductible. And that entire $2,000 bill goes to you. You have to pay that. Your insurance doesn't help out at all. So you have that one scan once in the year. That's $2,000. Blood work. Oftentimes you get your blood work covered for free as part of a physical. So I'm going to say you spend $0 on blood work. Your annual expense, 12 grand, 14 grand, 14.1. So $14,000 for the same care that you paid out of your pocket for $2,300. This is assuming you're not sick. This is assuming you don't fall off of a building. This is assuming you don't get diagnosed with cancer. You're going to be pocketing about 11 grand a year that you can put into your whatever retirement account, okay? Let's go to Cadillac Insurance policy. Now, a Cadillac Insurance policy is $2 grand a year. So you're paying $24,000 a year for your health insurance, or your employer is, that he could be paying you $24,000 more salary if you didn't have to pay your health insurance, and you would put that in the bank. Doctor's visits, we'll say Cadillac Insurance, you can go 100 times to the doctor, it's covered. You don't pay anything for your doctor visits. Medications, 100% covered. You don't pay anything for your medications. Your tests or scans, oops, you got a $1,000 deductible, not a $2,500 or $5,000. You go get that one scan, you're out $1,000 because you have to meet your deductible and you haven't met that. So we're going to put just $1,000 here. Cadillac Insurance, you will get blood work 15 times a year. They're going to pay for it, so no expense for blood work. So your expenses are about $25,000 a year, or somebody's expenses, for you to have Cadillac Insurance. So no insurance is actually cheapest by thousands and thousands of dollars because you are never going to get to use that insurance, okay? The problem is you need to have a doctor that understands that. You need to tell them, I don't have insurance, I have a high deductible, I'm paying for everything. So as an example, when somebody comes in and they need a CAT scan, I have that conversation and say, I can send you to the hospital, we can bill your insurance for that CAT scan. If it doesn't get covered, if it's goes to your deductible, then you're going to pay that full price for that CAT scan, or you can actually elect to have it done at the outpatient facility, just pay cash up front. They're not going to bill $1,500 to insurance and then come back and say, give me $350. You got to tell them that up front, and they don't bill the insurance. Medications, I write what's appropriate, but I definitely take into consideration how much medications cost. So if I know you're paying out of your pocket, I'm going to work harder to find you a prescription that you can afford. I'm going to go on GoodRx and I'm going to look at 3 different options, and I'm going to look at the bigger dose, cut them in half, and see where the cheapest price is. And I may save you $100 on your antibiotic prescription walking out the door for your strep throat infection, let alone your chronic medication. So think about it when you get your insurance. You have to be healthy. If you have a chronic disease, you need to have insurance to cover that. You're not going to pay out of pocket. You do have to play the odds just a little bit and say, I don't think I'm going to get sick. I'm 25 years old. I'm healthy. I'm going to go the cheaper route. And if I get sick, then I either go bankrupt or I meet my deductible and it costs me extra that year. So for the average healthy person, being underinsured may be beneficial. There's what's called major medical plans where you can buy where they cover nothing except over a certain dollar amount, $5,000, $10,000, some catastrophic injury they're going to pay for, but assume that you're going to pay everything. Don't feel disheartened because your neighbor's paying $1,000 a month for insurance he's never going to use. So talk to your doctor, find out what is best for you, ask him how much medications cost, ask him if there's cheaper alternatives to go into the hospital, ask him what doctors he knows that will take self-pay or cash patients, ask him what surgery center will give you an itemized bill up front as opposed to the hospital. So there's all kinds of ways you can save in this era of expensive health insurance that has less benefits than it used to have. Dr. Castello, thanks.